Hello everyone, welcome to my channel. Today's topic is qualities of nursing profession. We have multiple topics inside this video. This is the first one, qualities of nursing profession. Let's get started with the video. First quality can be nursing profession applies body of knowledge in practical services. Yes, nurses learn theory and apply that theory into practical. Example can be nurses learn about importance of range of motion and apply that range of motion into practical while caring for the patient. Next is constantly enlarges body of knowledge. Enlargement in body of knowledge occurs when there is constant update in knowledge and practice. When there is update in knowledge, update in practice, constantly means time to time, but there is an update, then it can help to enlarge the body of knowledge. And this update can occur because of research. Example is conducting research in newborn care helps us to find out which steps are taken while providing newborn care. Next is professional policy. Nurses have their own code of ethics and code of conduct. We have a video on both code of ethics and code of conduct. Please go through it. While working, they follow both code of ethics and code of conduct, and they have their own policy to develop steps of procedure. Example can be, in order to develop steps of post-operative care, nurses needs to go through policy of that hospital regarding post-operative care. How many hours to keep in recovery, how many hours maximum, minimum, maximum to keep in post-operative ward, how many days, for how many days the dressing is done, such things. So policy helps us to develop the procedure of practice. Next is utilizing practice. Practice utilization can be done basically through nursing care plan. Nurses find out the problem of the patient, develop diagnosis according to it, and then they implement the care, which is utilizing the practice. At the end, they evaluate whether the provided care was effective or not. And then they compare the initial condition of the patient and final condition of the patient. They find out the changes. Next is educational preparation for entry into practice. For entry into medical practice, whether it is in hospital or community, anywhere, educational preparation is required. This educational preparation can be done at any level, diploma level, bachelor, masters, or even higher level than that. Each level prepares us to work higher and higher. Like diploma level prepares us to care for a patient. Bachelor level helps us to prepare for patient care and management. Again, masters and higher level teaches us to govern a body, to govern an institution. Other higher level than that teaches us to conduct research on any topic. So that is educational preparation for entry into practice. Next is presence of skill, culture, values among members. Members means among nurses here. There is a presence of skill and culture among nurses, which is passed on from one generation of nurses to another. Nurses work with each other, work with other members of healthcare team. They pass on skill and culture from one to another. These skills, when updated with updated knowledge can develop creative problem solving and fruitful decision making among the nurses. Next is objectives of nursing profession. We are done with qualities, now we are entering into objectives. What nursing profession wants us to do? Our profession wants us to prepare the nurses who will give expert bedside nursing care. We want to also provide integration of health and social aspects in theory and practice. We want to provide educational, adequate, sound, scientific foundation to understanding the functioning of body and mind in health and disease. This can be done educationally. So it is the educational, adequate, sound, scientific foundation in order to understand how a disease works inside a body and how that same disease works differently in different bodies. Next objective is to prepare nurses to work cooperatively and develop sense of responsibility. If we work cooperatively and become dedicated towards our work, we are actually becoming responsible towards our work. We deal with lives every day. We deal with births and deaths every day. It is necessary to become responsible for whatever we do. Next is providing opportunity to develop skills and personality. Education, training, in-service education, these kind of things provides opportunity to develop skills and also to develop personality, professional personality. Upgrade nursing as a profession. These all above objectives that we discussed, if we are able to follow all this, then overall we will upgrade nursing as a profession. Next topic is basic nursing principles. While working as a nurse, what are the basic principles that nurses follow? Let's go through. First is safety. Nurses should make sure that even if they are caring for any age, children, old age or adult, nurses should be sure that patient care is not compromised and the care is technically sound. Whatever device they are using on the patient is safe for that patient and will give optimum results. Therapeutic effectiveness. Therapeutic effectiveness means all the care that is provided to the patient should be scientifically verified. Inside a nursing care plan, we have a rationale for every intervention. That means all the care that we provide, including bed making, including vital signs, including range of motion, position changing, anything that we provide to the patient, including medicine, including surgery, blood transfusion, anything, should be scientifically verified. And it is also evaluated at the end. Is the problem solved or not? It is evaluated. Comfort. While providing care, nurses should make sure that patient is physically and psychologically comfortable. Use of resources. Resources can be 3M: man, money, material. Human resource, man, of the nursing is nurse herself. Money is the finance for the care, and material are the articles, devices, anything that are used for the care of the patient, including the bed, including the pillow, including the devices, anything. Resources can be anything. Hospital itself is a resource, school is a resource. While you are providing care in the community, the local people can be a resource. Use of any local material can be a resource. So use of resources also comes in a basic nursing principle. Good workmanship. Workmanship means health team spirit, healthcare team spirit. Nurses work with other nurses and also other people under healthcare team. There are physiotherapist, doctor, occupational therapist, paramedics, laboratory technologists. There are pharmacists, many people working in a same team to achieve a common goal, that is solving the problem of the patient. So good workmanship helps to develop work spirit among all the members of healthcare team. Individuality. Development of individuality in the nurses comes after she is responsible for her work. She feels that she should be dedicated towards her work. After she is accountable for the work, she can answer why she provided the care and how she provided the care. Also, when there is professional development, however the nurse was providing care before, nurses has a better technique of providing the care now. And in coming days, same nurse will have even better technique of providing care. That is professional development. They will have better technique of providing care, better technique of communicating with the people, better therapeutic effectiveness. So all that comes under individuality. One individual, it becomes responsible, it becomes accountable and develops himself or herself professionally. In a way, he or she is developing individuality. Next topic is characteristics of nursing practice. We have learned characteristics of nursing, but this is characteristics of nursing practice. Nursing practice is the authority to control its own work and evaluate own work. We have a authority to control our own care providing work and also evaluating is that care effective or not. Next characteristic is exclusive body of specialized knowledge among medical professionals. We have a exclusive. Only nursing is a specialized knowledge separately. Every body of the medical care team has a separate knowledge. Similarly, nursing has exclusive specialized knowledge among medical professionals. There is extensive period of formal training with education and various methods of teaching like project method, problem solving method, assignment method. So formal training is educational period. There is an extensive period, decided planned period of formal training, theory, practical, both training with various methods of teaching like project, problem solving method, assignment method, etc. Next characteristic is we have a specialized competence. We have a way of working and that is specialized. We can control over our own work performance. We can decide whether our work is fulfilled or not, goal is fulfilled or not. We provide service to individual, family, society, and nation. We have a self-regulation through regulatory bodies, International Council of Nurses and Indian Nursing Council, self-regulatory bodies. We have a credentialing system to certify our competence. We provide license. Nursing Council provides license to the nurses that make them able to practice. They also provide educational credits if they are planning to work from one place to another. They also provide abroad verification if nurses want to go abroad for the study. We have legal reinforcement of professional standards. We have a set of standards that decides what is right, what is wrong, that decides how to make decisions. We have our own ethical practice, code of ethics, that states that every patient should be benefited from our care, beneficence. Every patient can receive care only after he or she gives informed consent. Next is creation of collegial subculture. Colleagues means people who work together for a common goal. There is a creation of collegial subculture among nurses. They have a collegial subculture of practice. Next is intrinsic rewards by nursing manager and officer. Whoever does fruitful work in nursing gets reward by nursing manager and officer. Public acceptance of nursing profession. We provide care, we do a work what we are supposed to do, and then we have public acceptance. Our profession, nursing profession, is publicly accepted as a profession. Those were the characteristics of nursing practice. Thank you so much. Next chapter will be discussed in the next video. Thank you so much for watching.